What is cancer or malignancy? To understand what is cancer, we have to first understand how cells are formed. Initially, you know how humans are developed, like a sperm fertilizes ovum and that makes a zygote. So zygote is a one cell stage where there is a nucleus that contains DNA and that is cytoplasm, and this is called a totipotent stem cell. Totipotent means that it has multiple potency. So it can forms eye, it can forms liver, it can forms kidney, it can forms blood cells, it can form skin cells. So it has multiple potency to differentiate into multiple cell types. That's why we call totipotent. And that totipotent stem cells in the process of division becomes pluripotent cells. Pluripotent cells. Pluri means it has potential to differentiate into multiple cell types, but the potency is now decreased. So this forms liver, this forms spleen, kidney, blood cells, that is called hematopoietic stem cells, skin cells, bone cells, muscle cells. Okay, so variety of cell types it can differentiate. And this one cell divides further to make whole organ. So you know that there are zillions of cells in the liver, and the cells of liver are called hepatocytes, and this collection of cells gives a shape, a solid shape, that we call liver. Similarly in a spleen, similarly in kidney. Okay, and this hematopoietic stem cell differentiate into multiple cell types like RBC, WBC, platelets, and this skin cells makes this skin whole skin covering of our body. This bone cells differentiates into makes multiple bones of our body, small bones, big bones, and this muscle cells makes the muscles that we have. Okay, so this one stem cell made multiple types of organs, different types of organs in our body. Now let's understand what is cancer. So let's suppose this is the liver of 40-year-old male. 40-year-old male. And you know there are zillions of liver cells inside the liver. So liver is a collection of liver cells. And let's suppose he has consumed significant amount of alcohol for a long duration of time, and what has this alcohol done that this is, let's suppose this is one cell, I have zoomed this one cell, zoomed out, and this is inside the nucleus, and this is the DNA of the DNA inside the nucleus. And let's suppose that alcohol, what has damaged there, it has created some mutations in the DNA. And what does that mutations do? That these mutations, this cell cannot undergo apoptosis. So normally cells undergo apoptosis after a limited period of time and new cells forms, but this cell cannot undergo apoptosis, and this has gained growth advantage over other cells. So this is now another stem cell. This is called cancer stem cell, because this cell has differentiated with mutations into another type of stem cell, and this stem cell has property to replicate without apoptosis. So this one cell forms another cells, and this one cell divides, again divides, and this goes on dividing. This goes on multiplying without apoptosis. And what happens that if this single clone of cell that goes on multiplying, what happens that it goes on accumulating inside the liver, and what happens that these cells now starts migrating through lymphatics, through the blood route. So when it goes through the lymphatics, it settles inside the lymph node. When it goes through the blood, it settles inside various organs of the body, like like lung, like brain, like kidney. Wherever it migrates, it settles there. Okay, and so this liver cell has migrated into lymph node. So this has converted lymph node into liver. So, and when it migrates to the lung, it has converted lung, some part of the lung, into liver. When it has migrated to the kidney, it has converted that part of the kidney liver. So you have multiple liver in your body, not just single liver, but multiple liver, in the liver even in brain, liver even in lymph node, liver even in kidney. So you have multiple livers. So there is no problem with multiple livers. But where is the problem? That inside the brain it goes and new liver is formed inside the brain. So what does that do is that compresses the neurons inside the brain, and that damages that neurons. So whatever function that neuron had, it cannot be able to do. So we will have neurological deficits. If it goes to kidney, so it disrupts that portion of the kidney, and kidney won't be able to filter the blood. It goes in lung, so that portion of the lung won't be able to exchange gas, and there will be problem. So the problem is not that you have multiple liver cells. The problem is that it hampered the organ of the particular organ where it has gone. And due to its rapid proliferation, what happens that even from brain it goes and migrating other parts of the body, because it is rapidly proliferating, and the rapidly proliferating cells spills in the blood and travels everywhere. So it can disseminate everywhere in the body. So this is the basic underlying pathogenesis of malignancy. So how can we treat that? So if there is the problem inside the liver, so let's suppose this is the malignant stem cells. So what we can do, that we can surgically remove this part of the liver, and the remaining part is normal. So there is a chance that if it is a small size and we can resect it early, then patient might not have relapse. But you cannot say, let's suppose this stem cells, let's suppose this has migrated somewhere in the lymph node, and it is there is only 1-2 cells there, and in that initial stage only even 1-2 cells you cannot even identify with PET scan. It does not light up in that stage. That is called micrometastasis, and that is not detectable. You resected it, but what happens that here stem cells has migrated. So what happens that from here it starts spilling into other parts of the body. So that's why the treatment of cancer becomes difficult, because of micrometastasis that we can not even to detect with advanced imaging modalities that we have. But let's suppose it has not migrated to other parts of the body, so we can resect it and it can be cured. But we have to follow up the patient regularly, so that we can detect if there is relapse, recurrent, or it has metastasized to other parts of the body. So we have to follow up. So one modality of treatment is surgery. Another modality is giving cytotoxic drugs. So there are variety of thousands of cytotoxic drugs. So what is cytotoxic drugs? As the name implies, it is cytotoxics. So it kills cells. So it not only kills liver cells, but other cells of the body. It does not distinguish that only have to kill the cancer cells. Wherever it finds rapidly proliferating cells, in the hair follicles, in the GI epithelial cells, because it is rapidly proliferating in the GI epithelial cells, there it kills. In the testes, in the ovary, those germ cells are proliferating, so those targets those. So wherever it finds rapidly proliferating, it kills everywhere. That's why it has multiple side effects. of these cytotoxic drugs, and which cytotoxic drug we give in which cancer, which type of malignancy. Like for lung cancer we give another cytotoxics, for liver we give another cytotoxics, for hematopoietic stem cells cancer we give another cytotoxics. So that we decide based on the studies that have been done in the medical field, like some combination of 3-4 drugs is beneficial for lung cancer, some is effective for liver cancer. So we decide based on the studies, the trials. So that is, we can give one cytotoxic drugs. Another is that we can give targeted therapy. So what is targeted therapy? It means that it won't kill all cells of the body, it targets. So what does it targets? So let's suppose there is a B cell, so it has CD20 receptor, so it targets the molecule called rituximab. It targets that B cell, so it only kills the cells expressing CD20. It won't harm other cells, it won't harm liver, it won't harm kidney, because they don't express CD20, so it won't kill those cells. Similarly, there is another drug called Bruton tyrosine kinase. So wherever cell there is Bruton tyrosine kinase, it only kills those cells. Okay. So these are called targeted therapy. Another is called immunotherapy. Immunotherapy, as the name implies, immuno and therapy. So normally what happens that when there is cancer cells starts growing inside the body, it evades immune cells. Evades means, for example, cancer cells have some different antigen receptors, so T cells starts try to kill that cancer cells because it looks foreign to the body, so it tries to kill. But cancer cells are also clever. It expresses some receptors, some antigens that defies the T cells, and it goes on proliferating. So what we do, that we block that receptor interaction with the T cells, so that T cell identifies it as foreign and it kills that cancer cell. That is called immunotherapy. And there are variety of drugs like pembrolizumab, nivolumab, that targets PD ligands, PD receptors, that is called programmed death. Another modality is CAR T cell therapy. CAR T cell therapy. So what is this CAR T cell therapy? So let's suppose patient has some cancers like leukemia. So what we do, that we extract T cells from the patient's body, and what we do, that we genetically engineer these T cells outside in the lab. We genetically engineer and we give some antigen inside that. So what does that do is that we give antigen means we modify the DNA to express that antigen. So it expresses that antigen receptor, and when this is now injected inside the patient's body, what does that, it finds the antigen on the cancer cells and it attacks that cells and it kills the cancer cells. So it has less side effect because it won't kill every cell of the body, but it will target the cancer cells expressing that antigen and it will kill that cell. So this is also one of the emerging promising modality in cancer treatment, and we are yet to see what will be the result of this in our setting, because we are not using this. Another is that in leukemia or blood cancers, what we do, that we ablate the whole bone marrow. For example, there are blasts, cancer cells. What we do, that we ablate this whole bone marrow with cytotoxic drugs. We kill all those and we transplant new stem cells, so that the new stem cells makes now functioning cells. It won't be arrested in the initial stage. So it will differentiate into the normal cells, normal mature cells. So one is stem cell transplantation, another is cytotoxic drugs, another I told surgery, another is radiation therapy. We radiate, we give radiation. So radiation also does the same thing, it kills the cells. So you know that cell proliferations has different phases, G1 phase, S phase, G2 phase, M phase, and then G1 phase. So this is called cell cycle. So this is the cell, with this phase cell undergoes proliferation. So the cancer also, radiations also kills this, cytotoxic drugs also targets different phases of the cell cycle. So surgery, radiotherapy, cytotoxic drugs, targeted therapy, immunotherapy, CAR T cell therapy, and stem cell transplantation. So these are the major modalities of treatment of cancer currently. And let's suppose if there is cancer metastasis inside the brain, so this has breached the blood-brain barrier and entered inside the brain. But most of the cytotoxic drugs, we have difficulty entering inside the brain. So what we do, we directly inject that into CSF, in the subarachnoid space, so that there will be enough concentration and it will kill the cancer cells inside the brain.